So what is the best way to get teeth whiter?
Depends how old you are. If you are under the age of 30 and, okay, first of all, if you brush your teeth every day, you're not going to have very much surface stain. Even if you drink coffee, eat blueberries, drink red wine. If you brush every day, and you're not going to get much surface stain. If you want your teeth, if nature has given you less than white teeth, if you're under 30, the whitening strips that you can get in any drugstore work quite well. If you can stick them on, they have quite a high concentration of bleach. Some people feel a stinging in their teeth or their gums, but it's harmless and it will get your teeth white. If you're over 30, these strips don't seem to do as good a job because the bleach has to get deeper into the teeth. Your teeth, you know, age is not fair. As we get older, our hair gets white and our teeth get yellow. You know, we get color in our teeth and lose the color in our hair. So bleach soaks right through the teeth, and then, so if your teeth are clean, you're over 30, and you're born with yellow teeth, blame your grandparents, and if you want them white, you need bleach in a tray. Now some people, again, at the drugstore you can buy bleaching kits where you put the thermoplastic in your mouth, put it in hot water, put it in your mouth, and then sort of suck and form it against your teeth and then put some bleach in. This doesn't work really well for everybody. So then if you go to the dentist, takes an impression, makes a tray that fits your teeth just like a glove, and then you put a little bit of bleach, and the bleach comes in various concentrations. The really high concentrations, which they say you can use 30-minute applications, tend to cause pain in most people. Again, it goes away, but who wants pain? So the lower concentrations take a little longer. A lot of them say you just need to keep it in your mouth for 2 hours. Well, in 2 hours, about 2/3 to 3/4 of the effect is achieved. The easiest way, I think, to do it is overnight. So before you go to sleep, after you brush and floss, because the organic matter on or between your teeth will use up the bleach, and it won't be as effective on the tooth structure. Then put it in your mouth and go to sleep, and it won't harm you. The whole bleaching process was discovered because somebody thought this would be a great treatment for gum disease by putting hydrogen peroxide, and that's the bleach that's used. And it's a carbamide, which then comes in contact with your saliva, releases hydrogen peroxide, which then turns to water and oxygen. Thought this would be a great treatment for gum disease because it kills bacteria. Well, the gum disease didn't really have any effect. It didn't go away, it didn't get better with the bleach held against the teeth all night, but the teeth sure got white. And they said, here we go, and that's how bleaching started. It's as a treatment for gum disease. So that's the way to do it. And the overnight treatment, you will see Zoom, I shouldn't have used that word, you will see quick bleaching systems. They don't work for everybody. In fact, they work for less than the majority of people. You get an effect for a few hours, or some people for a few days, and then the color comes back, because the bleach has to go right through the teeth, and that takes time. So I would just talk to your dentist about an overnight bleaching system. The 1-hour systems that you see sometimes at the fair, like instant 1 hour, they don't work for very many people. In fact, almost nobody.
When should a child have his or her first dental appointment?
Okay. Parents should brush their children's teeth. Now, some children really are not compliant with this, so if you can just wipe them off with a cloth around your finger, that you can get done, or just sort of hold your child and when they're screaming, brush their teeth. If you see brown spots, black spots, or actual broken or holes in your teeth, they should go to the dentist. If everything looks fine, age 3 is enough. There are some people who have kids who have rotten teeth earlier than 3. That's why I say that. But if you don't see anything yourself, 3 is early enough. The biggest cause of tooth decay in children is called baby bottle syndrome. It's children being put to sleep with a bottle in their crib, either apple juice or milk. It's not the bottle, it's not the nipple. If they're put to bed with a bottle with water, you're not going to get decay. But if it's apple juice or milk or some other juice, that the saliva flow slows down, it stays in contact with the teeth all night, and it causes decay. You'll see especially across the top front teeth, brown spots and then holes and black. And this is caused by the baby pod. And then eventually, the teeth will rot off right to the gum line. You say, well, they're only baby teeth. Well, yeah, but it hurts and it looks awful. And in many cases, it can affect the positioning of the adult teeth. So you've got to train yourself and your baby to go to sleep without milk or juice in the bottle, in their mouth when they're falling asleep. You know, when they drift off to sleep, but you can't clean it. So the answer to the question is about age 3.
Okay. And also, is there any other important information that you feel that we need to know that I haven't asked you?
No. No, I was going to...
Just brush, yeah.
Keep your teeth clean. If anything breaks, go to a dentist. Now, teeth get what I call like headaches in teeth. I get people coming in saying, a couple of days ago my tooth hurt for a few minutes or an hour, and then it never happened before, it never happened since. I'm able to eat, I'm able to drink hot or cold. What was it? Well, I don't know. It was gone. So if these phantom pains that come and go, it's like a headache. It's just, your teeth have nerves, and if you clench your teeth too hard, or if you eat ice cream after drinking tea, you might get a pain because the nerve has just been cold and then hot. So, but if a pain that comes and goes, it's very seldom and isn't responsive to hot or cold or chewing pressure, don't worry about it. So that's, I don't know if that's significant, but in any case.
And also, you live in Canada, but if anybody wanted to get in contact with you,
I have a website, drsamwinter.com, and you can email me through that. You have all my contact information, and there I am. Okay. And we have
wonderful. And you have something on YouTube.
I have a few discussions on YouTube: how to pick a good dentist, about tooth whitening, things like that. Why I enjoy being a dentist. Okay. Hardly anybody listens to that one. And I blog. I address subjects that my patients ask me. I write a blog. It's also on my website, and about root canals and about pain and about whitening and about metal fillings and my opinions. Everything that I write is based on my opinion and my experience, and not based on my own scientific research. Just my own reading, my own opinions that I've created over the years.
Okay. Well, we thank you for visiting us here in Kona, and we enjoyed the information. Thank you so much.
Oh, thank you. It's a pleasure.